channel. My name is Khadijat Adeshola, and in my channel I talk about everything related to midwifery and women. If this is your first time in my channel, kindly stick around, watch this video till the end, and if it's like something you're interested in, don't forget to share to your colleague that might benefit from it as well. And also don't forget to subscribe to my channel, then engage with this video. Your opinion, comments, put it in my comment section. I'm just going to I'm going to like check it and take it into consideration. If there's one thing that you think I should have added to this video that I haven't, please say that in the comment section. And also, let me just introduce myself to you briefly. My name is Khadijat, as you all know. I'm a midwife originally from Nigeria, and I trained in Nigeria as well, Lagos State to be precise. And I've only trained as a midwife. I only have my basic midwifery qualification from Nigeria. And I recently migrated to the UK as a midwife as well. And I'm now a midwife, registered midwife in the UK. Those of you that started my journey with me and all of that, that is just a little introduction about myself. So today I'm going to be talking about one of the important aspects of the midwifery NMC OSCE. So this video is for you if you are looking at migrating to the UK as a midwife at any point in your life, and if you are currently preparing for your CBT or preparing for your OSCE. So this video is for you. Basically, this video is for all midwives that are thinking of migrating into the to the UK and at any point in their life. This video, basically, I'm going to be doing it to NMC OSCE planning station standards, basically, but it is used in day-to-day activities as well in the world as a midwife. So what is this thing I'm going to be talking about? It is the SBAR. Yes, SBAR. If you've been reading for OSCE, if you've been reading for interview or anything, you must have known what SBAR is. So SBAR is an acronym for Situation, Background, Assessment, and Recommendation. What did we use SBAR for? SBAR is mostly used in handing over. So it is used to explain the situation of the patient to someone that is just coming to, like, you just want to hand over the care of that patient to another person. It is also used in consultant ward run. If they're having a ward run, you need to give a kind of brief history about that patient to the consultant. So the consultant who might not know the patient before, who might know the patient before, so you need to give a kind of brief summary about that patient. So you'll be using the SBAR as well. In OSCE exam, you'll be using the SBAR to plan the care of a patient, and that there is a particular station that is designed for SBAR, that is planning. So in evaluation as well, you use SBAR, but it's slightly different from the planning. So I'm just going to be talking about planning. So I can say that this video is a planning station of the NMC of the midwifery NMC OSCE. So if this looks like what you're interested in, please stick around and watch till the end. And let me ask you, have you subscribed to my channel? Okay, I'm giving you that time to subscribe now and also to like this video before I continue. Okay, thank you for doing that. I love you. Okay, so now the SBAR stands for Situation, Background, Assessment, and Recommendation that I just said, and I've told you when to use the SBAR. And this time around, I'm talking about the SBAR in the OSCE NMC OSCE midwifery exam. So it is the station 2 most of the time, and it is planning station of the API, assessment, planning, implementation, and evaluation. So you've done your assessment before, and now it's planning. Most of the time, this station is 16 minutes. You have 10 minutes to write it down, and you have 6 minutes to verbalize what you have written. It is stated that your writing will not be marked, but it's less likely that it is not being marked. So anything you remember that is significant, you write it down, then you'll be able to verbalize it as well. While verbalizing it, you can be reading from what you write. So it's very, very important to write the significant things that are important for you. You need to write them down. So in planning now, we talk about the situation first. Situation is what is current, what's the latest, what is happening now. Basically, that situation. So what are the things that is really happening now? The patient complaint. Why the patient came into the hospital in the first place, the complaint. When you do your assessment, don't forget that these are all, they are linked together with your assessment. So when you do your assessment, they already give you questions that the patient presented with. So this patient is 36 weeks and presented with lower abdominal pain, frequency of menstruation or whatever. So that is what is really, really happening now. So you say a name. Okay, James is para 1, 36 weeks pregnant. She's para 1, 36, she's gravida 2 para 1 basically, 36 weeks today, presented with lower abdominal pain and frequency of menstruation. That is the situation. Now, writing your name in situation is often optional, but you might want to write it there if you want, but it's optional. So you can say, my name is Khadija, the midwife at the antenatal ward. I met James, who is gravida 2 para 1. Sorry, James is masculine, right? Okay, I met Joy, who is gravida 2 para 1, currently 36 plus 1 today, presented at the emergency unit or at the delivery suite, at the wherever, with lower abdominal pain and frequency of menstruation. That is the situation. Now, remember the things you said in that situation. Who is she? How old is the pregnancy, and why is she here? That is basically the situation. Now, the next thing is background. What significant history does this person have? So in that background, you want to talk about what happened to her previous pregnancy, obstetric history. So she got pregnant before. What number of pregnancy is this? If it's number 2, what happened to the previous pregnancy? Is it an SVD? Is it a cesarean section? If it's cesarean section, why did she have that cesarean section? The previous baby, is it deliver time? Was the baby time when they delivered that baby? Was there any postpartum complication? Was there any postpartum hemorrhage? Was there anything significant? That's obstetric history. Now, medical history. Is this patient currently on any medication? Is she patient currently having any other medical condition like diabetes, hypertension, obstetric cholecystitis or anything? Does this patient have any current medical conditions? What is this patient hemoglobin level? It's very, very important because she's pregnant. We want to rule out if the hemoglobin level is very, very important, because if it's very low, she's going to be affected with even very little blood loss. So you want to know that it is very, very, very important as well. Okay, if the hemoglobin level, the last one was low, was she on any hematinics? Was she on various sulfates? You want to say that as well. Then what is this patient blood group and rhesus factor? Is it rhesus negative or rhesus positive? Rhesus negative, is she taking anti-D at 28 weeks or something? So you want to know. If she's rhesus HB as well, if there's any need, like rhesus wherever, blood group, if there's any reason to transfuse blood, you want to know all of those things. They are very, very important. And another significant aspect is, does this patient have any allergy? Any known allergy? Okay, this known allergy, what reaction does this patient have after taking that medication? So those are the significant things you are putting in your background. So your background wants to be like, Joy is gravida 2 para 1, had previous spontaneous vaginal delivery at 37 weeks, in 2022, no postpartum complications, and she's, her last hemoglobin level was 98, and she's on ferrous sulfate 200 milligram daily. Her blood group is A negative, and she has taken Hantide at 28 weeks, and she's allergic to penicillin, which she has severe anaphylactic reaction whenever she takes penicillin. That is background. Yeah. She doesn't have any known medical conditions. That is my background. Now, in the assessment, you go to the assessment. What are you saying in the assessment? Those observations that you've done, you're putting them in the assessment. Yeah. And those observations include blood pressures, respiration, oxygen saturation level, temperature, abdominal palpation, fetal heart rate, and urinalysis that you've done in station 1. So you're putting those observations in the assessment station. So the assessment phase, excuse me. So your assessment will look like, okay, Joy is feeling well. Joy feels well or feels unwell. She feels fetal movement. Our blood pressure is temperature, respiration, oxygen saturation level, and abdominal palpation. Presentation is cephalic, longitudinal lie. Fetal heart rate 132 beat per minute. Head is 2 feet palpable. She is no knee contraction palpated on abdominal palpation, and our urinalysis is glucose positive, glucose negative, protein positive. All the other parameters were normal, and our total MEA score is 2. That is your assessment. Then the next thing you want to talk about now is, okay, you've done all of that. What do you think Joy is presenting with? Okay, is all of our blood pressure values fine? If your blood pressure is slightly raised and there's protein in her urine, you want to query preeclampsia. If she's having pain and she said her pain score is 2 and she's still currently having the pains and all of that, you want to lower abdominal pain, and she also have pain when she's going to the to urinate, or frequency of menstruation, you want to query urinary tract infection, or you want to query preterm labor or early labor, depending on the presenting complaint. So you have to give a kind of professional diagnosis in that you're writing. So you will do your planning, your recommendations. So you give your recommendations. So differential diagnosis is urinary tract infection, querying preeclampsia, and early labor. So your recommendation will be that inform senior midwife immediately for obstetric review within 1 hour. Then you want to take blood samples to rule out all of those things that you said. So you take blood samples for FBC, liver and kidney function test, urea and creatinine levels, to find out, to rule out, preeclampsia and also any kind of infection. You want to take midstream urine for, you want to send midstream urine for urinalysis and protein creatinine, protein creatinine ratio, basically PCR. Then also you want to make sure the baby is still fine, so you want them to auscultate this baby, fetal heart rate every 1 hour, or better say commence CTG to assess fetal well-being. And also you want to educate Joy about preventions of recurrent urinary tract infection, and also you want to tell her about personal hygiene. Another thing is you want to administer prescribed analgesia and antibiotics. And that is that about the planning station, and that is all. So after reading all of that, when you're done, within that 10 minutes you write, then you stand up after 10 minutes to read it out to the to the examiner, and that is the end of your planning station. It is all 16 minutes in total. Then after that is the end of your planning station. and that is if you are using it for exam purpose. If you're not using it for exam purpose, it's still more likely the same thing. If you're handing over, you still have to do your SBAR situation. What's the current situation of this patient? Or if you are transferring a patient, you want to say, okay, well, this patient is para 0 or para 1. She's 36 weeks pregnant today. She's currently complaining of pain, contracting 2 in 10 minutes, this and that. You want to talk about her background. Does she have any medical conditions? Is there anything significant that the person you're handing over to she needs to know? You want to talk about the placenta if the patient is being transferred for delivery. You want to talk about the placenta locations and the baby's weight. Is the placenta clear of us? What's the baby's height to expect? What is the weight of the baby they are actually expecting, and what is the gestational age of this baby as well? Any investigation in the assessment, you want to put out any investigation that you've done. You want to talk about the platelet level, hemoglobin level, and the date that was done as well. As this patient had any inducing agents, was this patient induced? You want to put it there. Okay, this patient had propers, had this, had that. When is it coming out? What is the situation now? What is the vaginal examination and all of that? Now you want to put it out. And what is your recommendation? Is there anything significant or anything you want important you want them to do for this patient? It looks like I rushed this video basically, but I hope you get to understand what I said, and I wish, or I hope you've already like and subscribe to my channel. Share my videos to other of your colleagues that might benefit from it as well. And thank you for always watching my video. See you in my next video.